like his seed oils, but he's
You like seed oils? You can't defend seed oils, man. Like if you look at the randomized controlled trial, the only trials that say the seed oils are benign are like the methodology's garbage, right? They're using messed up groups. They have multiple interventions. They're using oxidized fats, trans fats in the control groups. Like
this is a clip from a recent discussion/debate between Jacob, who's a dietetic student, and Paul Saladino on the topic of seed oils. And Paul rattles off a bunch of very vague criticisms about studies done on seed oils, with the particularly ironic comment that apparently the non-seed oil groups were getting more trans fats in these studies. Just remember that because we'll come back to it.
More seed oils equals more LDL oxidation.
This isn't necessarily true. The polyunsaturated fats in seed oils may raise the susceptibility of LDL to oxidation, but they also lower the amount of LDL. This could result in less total oxidized LDL. And whether seed oils even do increase the susceptibility of LDL to oxidation largely depends on the fatty acid profile and antioxidant content. For example, in this study, sunflower oil reduced the susceptibility of LDL to oxidation when accompanied by antioxidants compared to even olive oil. And this study found that canola oil can lower the levels of oxidized LDL in the blood compared to butter.
Which is a greater risk factor for cardiovascular disease, LDL or oxidized LDL?
Well, I'm also not a cardiologist.
It's oxidized LDL.
So Jacob displays some humility while Saladino displays the Dunning-Kruger effect. He also doesn't cite any sources, but I did find this on his Twitter. But it doesn't support his claim that oxidized LDL is a better predictor than LDL. In fact, I couldn't really find studies directly comparing the two, but there is this study comparing oxidized LDL to ApoB. And LDL does make up the vast majority of the ApoB containing lipoproteins. And this study shows that ApoB is a better predictor of cardiovascular risk.
3 or 4 meta-analyses, systematic reviews.
Okay, so the problem with the meta-analyses is it garbage in, garbage out, right?
So before Paul even knows which meta-analyses he's citing, he just starts criticizing their quality. In other words, he doesn't like it, so it's bad.
First of all, throw out all the cohort studies. I don't care about that. If you're looking at those studies, I want to see adipose levels of linoleic acid.
Don't worry, I got you, Paul. This meta-analysis of cohort studies found that higher adipose tissue levels of linoleic acid were associated with significant reductions in all-cause mortality and non-statistically significant reductions in cardiovascular disease and cancer mortality. So we see a roughly neutral to beneficial impact on those outcomes based on a metric that he claims is good. So he should accept that, right? Not to mention that adipose tissue levels of linoleic acid rose substantially in the intervention group of the LA Veterans randomized controlled trial, and there was clear benefit for cardiovascular risk.
You look at randomized controlled trials with seed oils, the only good ones show they're horrible. Minnesota coronary experiment, City Diet heart experiment, and rose corn oil.
The seed oil groups in the first two studies he mentioned were likely consuming large amounts of trans fats in the margarines that they were given, and about 3/4 of participants failed to even stick with the program for 1 year in the Minnesota study. And the Rose study was very small and did not detect a statistically significant increase in risk, so I don't know what he's going on about. Yet he considers these high quality for some reason.
Like, we will go through this, and you will not be happy in the end.
Why don't you and I go through it? I'm game.